Okay, good afternoon ladies and gentlemen, my name is James Hayden. I'm a criminologist in the School of Social and Political Sciences. Over the past week, my 18-month-old son has taken to hiding things under the furniture, and yesterday he hid my watch, so I'm going to have to use the stopwatch on my phone. So yeah, thanks guys. So yes, I'm going to talk to you today about whether or not an emerging technology, which is air pollution monitors, can help to protect children on the school run from the dangers of air pollution. I'm working with Rohit Chakrabarti at the University of Sheffield to do this. So I'm going to take you through a few different things: the harms of air pollution, where the use of this technology is starting to come from, the methods, and then where we're going to go in the future. So the first things first, we're going to look at something, excuse me. Okay, does anybody know who this is? Yes? Good, yes. This is Ella Kissy Deborah. Ella was a 9-year-old schoolgirl in London, and between 2010 and 2013, Ella was admitted to hospital 27 times with seizures, asthma attacks, that sort of thing. Unfortunately, in 2013, Ella died at the age of 9. So the coroner's report said that Ella had died from respiratory failure. But last year, a study came out which looked at the air monitoring station a mile from her home and found that there had been repeated breaches to the levels of air quality over the periods in which Ella was admitted to hospital. So as a result of this, a public inquest has just been opened, and she may well be the first person in the UK to have air pollution written onto her death certificate. So it's quite clearly a significant form of harm. But death is not the only consequence of air pollution. The harms are pervasive. And this is a recent report this year, from a recent report this year that was commissioned by the World Health Organization, which found in its systematic review that the impact of air pollution affects almost every organ in the body. All sorts of things from strokes, 24% of strokes are associated with air quality. Lung cancers, worldwide 30% of lung cancers are associated with air pollution. All sorts of things around leukemia, bladders, osteoporosis, particularly in old people, and also skin issues. And these impacts are felt more acutely by children and the elderly, because obviously they are either frail or still developing. So the harms of air pollution are pervasive. You cannot escape them necessarily. So because of this, you might be thinking, well, what's being done about it? And unfortunately, the answer is, it's starting to get better, but the answer is not too much. So 3 times the UK government has been taken to court by Client Earth for the lack of plans and lack of strategy in relation to the EU's air quality directive that it's supposed to be following. And the most recent one was only last year, which effectively gave Client Earth the power to take the government to court if it had not acted sufficiently to comply with the EU air quality directive. Again, internally, the Environment, Food and Rural Affairs Committee have shamed the government by saying, look, you're not doing enough to protect people's health. And finally, the UN has also said that the UK government's plans are not adequate to protect the health of its own citizens. So in this, I won't say vacuum of government activity, but certainly in this space, citizens have been taking it up on themselves to try and measure air quality and avoid the issues associated with it. So what we're starting to see is people take advantage of this emerging technology. Okay? Together tends to be called the Internet of Things. So we've got monitors here that hook up to your phone, tell you levels of air quality as you're moving through them, particulate matter, volatile organic compounds. We've got seen people strap things to their bike to measure air quality on polluting routes. Children and people in schools are making their own air quality monitors very cheaply out of Raspberry Pis and Arduino microcomputers. And people are getting together on Twitter to try and mobilise and organise around this. So citizens from below are trying to act on this and trying to put pressure on those with the power to change things. Now, this is the biggest project in terms of citizen action, possibly in the world, certainly in Europe, and it's known as the Luftdaten project. And these monitors are very effective, very accurate, and they only cost £35. So people have been installing them all around Europe. Based in Germany, but there's about 9,000 in the UK now. And the biggest concentration is in Sheffield. And this is outside my house. My wife is very happy about this, a nice drain pipe on the front of the house. But it all contributes to this map where you can effectively see how good the air quality is. But this isn't what we focus on. We focus on this new technology. It only came out in September. And what this does is this traces the quality of your air wherever you move, okay, and then displays it on screen. So as you can see here, the purple is the worst type of air quality, the worst areas of air quality. Then we've got red, then it goes to yellow, and then green is the best, okay? So what we've been using is this technology. We've been giving it to parents who go on the school run and trying to understand how they respond to it. Because ultimately, we don't know much about this technology, right? It's brand new. So the existing research that has come out says it might have an impact, but the studies are very small. It also says that it might change their perspectives and their behaviour. So there's a little bit of a mixture there. But there's also limits to this technology. It's inattentive to the transformative process. How do people decide what to do with this data? Do they discuss it with people, or do they make individual choices? How does the data influence perceptions of responsibility? These things are very individual. So does it make them think, oh, well, I can't do anything to help, or I can't do anything, I'm very powerless? Or does it make them say, hang on a minute, local authority, it's your responsibility to do something here, what's happening? Methodologically limited. Previous to this study, the largest study was of 14 people, okay? And there were only 3 of them. And it's atheoretical. So we're using something called coping theory to try and frame some of these decisions. I'm not going to talk about it in too much detail now, but essentially none of the existing papers focus on theory or use theory to guide what they're seeing. So what did we do? Well, as I mentioned, we gave these monitors to parents and carers on the school run. It started in April. The target is 45 participants, mainly because that's how many we can get before the school term finishes. And essentially, by the end of next week, we'll have all of them. We'll have all 45 participants interviewed. Prior to their using the monitor, we survey them for their existing concerns, their existing understanding of air quality issues, what type of route they use, what type of mode of transport, that sort of thing. And then I interview them afterwards to try and understand, well, what impact has this monitor had? Have you been using the monitor? What sort of things has it been eliciting? And then at the end, we give them a 2-week summary of their air quality data. Rohit compares these with World Health Organization limits, and also, interestingly, converts the number into cigarettes smoked, which you can do with particulate matter. And so, for example, if you were in Sheffield for the month of April, over that month you will have smoked 32 cigarettes, approximately, just by being in Sheffield. And then we're going to give them the opportunity to participate in solutions workshops, which is useful if they do not feel like they can pursue any solutions. So these are very preliminary findings. As I mentioned, we're in the middle of this now. Okay, so what is actually happening? In the event of high pollution levels, the initial emotional response is surprise, shock, concern, worry. Then people try to change their behaviour. They try to take different routes, they perhaps use different forms of transport, but very quickly they come up against structural constraints like, well, I've got to be at work on time, I've got to be at school on time, there's no cycle infrastructure, there's public transport, it's too expensive. So very soon, those structural constraints stymie the extent to which this technology can help them. And then finally, because they effectively say, well, I can't really do anything, they don't change their behaviour too much, and it doesn't really affect their knowledge. They don't then go and search for more information. But it did disrupt the green is clean idea, which is what they had in Sheffield, which is a very green city, so they think it's immediate, they think it's green, but unfortunately it's not. So really, the technology, as we're starting to see now, has limited potential to protect children on the school run, largely because of these structural factors. So what we are going to suggest is that the technology needs to develop a social element. It has to have discussion forums, it has to have some sort of sharing capacity so that people can mobilise and organise around the issue of air quality and the data that they're seeing in order to challenge these structural constraints that they're coming against. Thank you very much.